Hi, my name is Dr. Tom Sladek, and in today's video, I want to share with you a very important concept. The concept of the true cause of heart disease. The cause of heart disease is inflammation, systemic inflammation. Inflammation damages the wall of the artery, and that's the problem. So, behind me, you'll notice I drew a diagram. Now, I'm not an artist, and I never will become an artist. It's more important for you to understand the concept as opposed to me drawing very fancy diagrams back here. But, so let's take a look at this. I drew an artery, okay? Arteries are like hoses. Blood flows through the arteries, which is a concept you already understand. Now, the interesting thing about the artery is the artery has a lining, one lining inside. So inside, you see the line that I drew right here? So there's a space between this layer and that layer, and then the inside. So there's a space here, and this layer right there, the inside layer, is called the endothelium. And the damage occurs in that space right here, called the endothelial space. So what happens is, what is heart disease? Heart disease, many of you probably visualized or heard, is the accumulation of plaque that blocks the arteries. So that's what I've drew here. So you can see the accumulation of this plaque causing a narrowing of the artery. So now the space where the blood flows, it's narrower. So not as much blood can get delivered to where it needs to be. That's heart disease. We want to stop that. We want to stop that, and we want to find out what causes that. And that's what I'm going to share with you. So chronic inflammation, what is that? And I want you to visualize this. You've all sprained your ankle before, and you've all probably seen swelling. Okay, that's your body's immune system coming to fix something, coming to repair something. It's bringing things to the area to fix it. It's the immune cells that are going to gobble things up and repair the area. So when you have inflammation, which on the arterial wall is best described this way, and I found patients when I share this analogy with them, they really get the concept. So I want you to take your forearm like this, take your other hand, and just start going back and forth, scratching your forearm. Go back and forth, back and forth, back and forth. You can go a little bit harder, but just keep going back and forth. Now, what you'll notice is your forearm's going to start to turn red. And if you keep doing this for a week or two, or imagine inside your arterial wall, maybe a year, 5 years, there's damage there. Okay, that is inflammation. That inflammation is going to tell the immune system that there's a problem here. We need to go and fix something. So the immune system comes to the area, brings monocytes. Monocytes are the immune cells that come to the area, to the site of inflammation, and start gobbling things up. And monocytes have a big appetite, so they keep eating and eating and eating until the problem's gone. But if you don't get rid of the inflammation, they're going to just keep eating and eating and eating and build a plaque. So you can see in the first phase here, there's these blue cells that demonstrate oxidized cells, and it could be LDL, oxidized LDL, which could be cholesterol coming to the area. Again, cholesterol has a role in repairing cells. So it's a raw material used. So cholesterol is going to be in the area, and these monocytes are just going to start eating everything up. They're going to keep gobbling up, and this plaque and this stuff underneath the endothelial space is going to continue to get bigger and bigger and bigger and bigger until the scratching starts. And we'll find out how to take care of that in other videos, but I just want you to understand the concept. The problem here is the damage along the wall. Now, what will happen when a heart attack occurs, you can see this, it looks kind of like a blister. And when this endothelial layer right here around the plaque becomes unstable, the garbage that's inside underneath the endothelial space will spill out into the bloodstream. And when that happens, a blood clot's going to form. Blood clot's going to form, blocking the flow of blood that way. And obviously that's going to the heart muscle isn't going to get oxygen, and that's your heart attack. That's how heart attack occurs. So the solution here is we need to find out, we don't want this progressing, and we don't want this endothelial layer to become unstable. The key is to find out what's causing inflammation, and also whether or not you have an inflammatory process going on, which you will learn in other videos. In today's video, I want you to understand, if this inflammatory response was not here, for example, if we don't have the scratching on the forearm, none of this is going to occur in the first place. So it doesn't matter what your cholesterol levels are, because cholesterol is just going to flow through freely along the artery. Okay, so if you like this video, share it with your friends. If you need more information, visit my website.